NCD prevention. So the question to all three of you is, how can we incentivize the private sector to be more involved and encourage individuals and communities to be more engaged? I'll start with Dr. Adinoyi. Doc, please put your mic on.
Sorry. So apologies for that. So yeah, before I go further into answering your question, colleagues have mentioned in terms of prevention, control, management, because of the nature of the business, the pharmaceutical industry, banking industry, insurance, fitness industries on one side. And on another side, you have those whose activities or commercial interests would impact negatively on our interests for the control of non-communicable diseases. And I don't want to mention names, but you know the products that are risk factors for non-communicable diseases. So those are the two spectrum. Then on one side of the first one, the private sector, where their commercial interest could really facilitate and bolster and foster positive actions on NCD. I think what is required is more engagement and multi-stakeholder collaboration between the governments, as have been mentioned previously, actors like ourselves from the civil society, and most importantly, the people living with non-communicable diseases. So building a multi-stakeholder partnership around this, whereby the interest of everybody can be put in perspective for long-term planning, long-term investment, is very, very crucial to move forward in terms of bringing private sector on it. Then for those on the other side, whose commercial interests and activities affect NCDs negatively or risk factors for NCDs, there is also a role for them with respect to working with government with appropriate regulatory frameworks that would really ensure that incentives for their businesses are in line with public good, the public goal of balancing what they are likely to gain from their commercial activities to the conflict of interest that would arise from us wanting to promote better living and healthy living of our population. We've seen that working in some places where consumer products that are risk factors for NCDs are forced to have labelings. There are other regulatory mechanisms, reduction in advertising, restriction of tobacco use in public places. So all these can be ways that we could work together to ensure that there is harmony and synergy, no matter from which part of the divide you're coming from, either from those who affect negatively or those who can affect positively. We work together for a common interest. So this will be my suggestion on how we could really work together in a multi-stakeholder collaboration to promote healthy living and prevent NCDs. Thank you.
Thank you, Dr. Ben Adinoyi. Let me come to Mrs. Elizabeth Daniel with the same premise. How can we incentivize the private sector to be more involved and encourage individuals and communities to be more engaged in NCD prevention?
Thank you very much for your question. The best way to incentivize, give incentives is even the NGOs and organizations being accountable when we receive donations or money from other setups. It will ease the burden of donor fatigue and create good partnership situations. Also, our health systems allowing the NGOs and the various sectors to actually work hand in hand. We are disjointed. So NCD Alliance, other federations should have a seat at their mother ministry so that they work hand in hand. Secondly, there could be scholarship packages for doctors who are interested in endocrinology, nurses who want to be educators, and even those who go into the community to give the insulins, give nebulizers. If they can get a little bit of allowances on top of that, I hope we will go a long way in achieving our goals of curbing NCDs on our continent. Thank you very much.
Thank you. Thank you very much. I'm giving the last word on this panel to Dr. William Bosu. How do we incentivize the private sector to be more involved and encourage individuals and communities to become more engaged?
Okay, thank you, Bernard. I think Dr. Adinoyi addressed or mentioned several of the points I have in mind, spot on. First, as is mentioned, the private sector is not just a homogeneous group. But let me tackle the difficult group first. So these are the groups that make unhealthy or less healthy products. Often when we talk about non-communicable diseases, the reason they are really important for us are because they are the ones they have. So when it comes to their supply chain, they have a very articulate, robust mechanism where you find their products virtually in every corner of the region or a country. And then they have aggressive marketing tools. They lobby at the highest level. So the lobbying, the capacity, the fund. We tend to think about these because some of the products, the products that they make, when we say is unhealthy, they're energy dense, they are high in fat, they are high in sugar, and all of that. And often the difficulty is what counts. For them, it's the bottom line. So if you posited an altruistic argument to say that, look, we need a healthy state, a country that has a large burden of chronic, people are chronically ill. And by the way, that's what non-communicable disease does. It has the notorious habit of tipping you into poverty and maintaining you there because it's chronic. And so when you think about the chronic kidney diseases, the dialysis, and that they are exceedingly expensive, the cancer treatment and all that. So we need to look at the altruistic position that if a country has population that is generally healthy, the economy is better, and then the private sector, those who are producing, manufacturing these, people who are consistently absenting themselves from work and so on. But as I said, in real life, there's always a tension between public health and where there are commercial interests, because for them, the bottom. That said, I think that, again, it's important to recognize that there are shared objectives, that even for them, where standards have been clearly defined, because it's important for the state to be fair, so that you don't favor, if you take the example of, say, salt or sugar, if the standards are clearly defined and all the industry is trying to make food that's respecting the same standard, then you're not favoring one industry over the other. So I think it's important that we set these standards. Also, that it's important that there is room for self-regulation. And there have been examples even for salt. And then recently, well, even within our own region, because if you take the example of the broth, the bouillon cubes, they have different brands. I don't want to mention in particular, but these are the cubes and spice that we add to they are very heavy salt. And some of these themselves have started regulating, and some have reduced the salt content by as much as half. So there's room for self-regulation, except that it doesn't always work. If you could get the professionals or the Chamber of Commerce or the industry's own ethical the code of ethics to help in the maintaining ethically, it probably helps as an. But I think that we also need to provide tax incentives so that if a pharmaceutical company is producing insulin, and we know insulin is life-saving, can we help to make these products cheaper? Can we help to improve local production of these products that are largely healthy? And healthier foods are generally more expensive. So if you have chicken, for example, that has a lot of fat on it, and you want one that is, it tends to be more expensive. So are there technologies, I don't know, is there a way in which, whether it's the state giving incentives or incentivizing them so that some of these healthier products are cheaper? But when it comes to the other, the less, if like, they're not, those who are not producing, we are not focused on products, but looking at service. So anything from the private sector that is involved, from health promotion all the way to rehabilitation, because when we think of private sector, we hardly think about the chemical seller who is in the corner somewhere, in a village somewhere. They are part of the private sector, providing a service that the government alone cannot provide. So with those groups, I think that it means that at the decentralized level, it's important to recognize them, to engage them. And I asked Dr. Adinoyi was to work really well. Is the whole, and I think the COVID has brought that to the fore. Is the whole, we are digitizing our economy, we are digitizing health. So whether it's the management of health information, whether it's, we really must work with the mobile telephony companies, the internet service providers, and those involved in producing medical products based on technology. So whether it's telemedicine, e-health, m-health, it's important to recognize and develop this partnership. So I think that the bottom line is really important to engage the private sector, but in doing so, there has to be clear terms so that we avoid issues of conflict of interest. And where they are doing well, we should not hesitate to reward them, that we thank you for this, whether it's a certificate or citation or something, so that we provide these incentives and not only look at private sector as people who are interested in money and just out there to produce whatever goods without regard to the public good. Over.
Thank you very much, Dr. William Bosu, professional responsible for NCDs at West Africa Health Organization. Our other panelist, Dr. Adeiza Ben Adinoyi from the International Federation of Red Cross and Red Crescent Societies, and Mrs. Elizabeth Daniel, Regional Chair, International Diabetes Federation. We thank you for your insightful contributions to this ongoing discourse. We will now take a testimonial or some testimonials from some persons living with NCDs in this short video.
My name is Francis Isao Kujo, a person living with diabetes, a non-communicable disease, for the past 5 years. Prior to me being diagnosed diabetic, I was an employee of BOST, Bulk Oil Storage and Transportation Company. I was also a product of Legon, where I was the Vice President of Association of Social Work Students. I was a businessman, I was paying my taxes, I was contributing my quota to the development of my country. I am from a middle class family. Diabetes stole everything from me. After being diagnosed diabetic and there came a change of government, I lost my job. But because of diabetes, I could not get a new job and life became unbearable. Life became so difficult and tough for me because the medication of diabetes mostly are not covered by the health insurance and I need to pay out of pockets. So that made life very unbearable for me. It became very expensive. I lost almost all my friends. People deserted me. Even my wife told me she was going to visit her mother and back and never came back till now. Life became so unbearable that I lost all hope and everything. I could not contribute to the development of my nation or anything again until I met people of Non-Communicable Diseases Alliance who made me know that I have a voice, I have something in me, there's something good in me, all is not lost, I can make it. And they helped me to gain back my life, that today I'm here talking to you about diabetes. I also thank Ecobank for its initiative, its support of diabetes across Africa. What you are doing, we all are seeing and are acknowledging and thanking you for the good work you are doing. Thank you.
Diabetes is expensive and it doesn't kill. It hardly kills instantly. The only time diabetes kills instantly is a hypoglycemia where your sugar is low. But in a hyperglycemia, it kills you slowly. Eventually, your kidney will go off. If you're not lucky, you might get blind. You could have a liver failure. You could even have gangrene as a result of amputation. So we're saying if you are able to save 10 cedis now to check your sugar and eat well, do it, because it might cost you 1 million cedis in 10 years' time if you don't change your habits and change what you do now. So let's watch our diet, bite it right. Before you put anything in your mouth, ask yourself, what am I going to gain from this? Sugar on your tongue is good, but not in your blood. It destroys everything, even involving your fertility. Men have impotence, you lose your hair, you lose your beauty. Diabetes, in fact, affects every part of your body. So if we can spare 200 Ghana now to buy a glucometer to test your sugar and know your status, it will be better than waiting for 10 years where your liver will not work, your kidney will not work, and then you will be jumping from hospital to hospital because it kills slowly.
Thank you very much. Those were some testimonials from people living with NCDs. Don't forget, today's Ecobank Day webinar panel is part of the bank's CSR activities for 2020 and part of Ecobank Day events celebrated across 33 African countries in which the bank operates. We are live on myjoyonline.com. We can also be seen on the social media pages of Ecobank in the Gambia, Ghana, Guinea, Liberia, and Sierra Leone. We now want to take some brief remarks from our co-host, who is the Chief Information Officer of the Ecobank Group and MD of eProcess International. He's really going to tell us more about some digital interventions that have been put in place for people living with NCDs. Dr. Thomason Fashina, you have the floor. Take it up.
Thank you very much, my good friend. Good evening, everybody. Colleagues in Ecobank, members of the press, panelists, ladies and gentlemen. Should I just say all protocols observed? We've been hearing quite a bit about NCDs. Would my presentation be coming up, please, technical support? I'm just waiting for my presentation to come up.
Hello, Doc. Please, Mamusi is supposed to share it, so we are standing by for that.
Okay. If I can, I'll just wait for the presentation to come up, and I'll continue from there.
Okay, thank you. So while we wait, we want to just let you know we are live on social media, Facebook, Twitter, and Instagram at the Ecobank pages of most of the countries represented here. In fact, all of them, and also on myjoyonline.com. We are taking a presentation from the Chief Information Officer, Ecobank Group, and MD of eProcess International, Dr. Thomasin Fashina, who is now sharing the presentation. Doc, your presentation is up. You can go ahead.
Thank you very much. You know, technology is brilliant. When it works very well, then it's fine. Okay, thanks. I'll just be sharing very briefly over the next a few minutes on digital intervention for people living with non-communicable diseases. You know, today, everything is digital. Whatever we do, we find digital in one way or the other. You have done a lot of justice, and I've had very educated doctors who have spoken a lot about NCDs. This year, we're specifically focusing on diabetes, but like we all know, NCDs include cardiovascular diseases, chronic respiratory diseases, cancer, and all the others. And the statistics are everywhere, and the sheer number of people that die from non-communicable diseases every year is staggering and alarming. And like you know, the fact that this quantity of people, 17.9 million people dying annually, it means that a market has been created for engineers and scientists to find digital solutions that enable people to better manage NCDs in their life and the risk of succumbing to NCDs. And over the years, several technologies have come through. When we say digital intervention, we discuss about tools, technologies, and devices that enable individuals to support themselves. That is used to support health systems. Digital health interventions have contributed greatly to improve long-lasting survival rate, because one of the things that is common to people living with NCDs is the need for a constant check to know the status of your health, or the need to visit the hospital frequently. With a busy world that we have today, quite a number of people can either not make it to go into the hospital to check their blood pressure, check their heart rate, check so many things that they need to keep checking. But the advent of technology and digital intervention has made this checking and monitoring of your vitals, of the functioning and operation of your vital organs to be a lot easier to manage and monitor. And different type of devices have come through over the period. Today, we have several devices that have been created by different manufacturers to enable the individual to manage their body systems, to enable them manage everything from what they consume to how the activities that they perform, and how they generally self-manage their health, that enables them to live a much longer and much fulfilling lifestyle. So the advent of digital into healthcare, empowering the individuals to understand the state of their health and enable them to make the right choices in the things that they do and how they do things, is where we call digital intervention in healthcare. We have all sorts of things from the artificial intelligence technology, digital tracking technology, that ensures that without you having to see an expert, you have an idea of the functioning of your body that enables you to make the right choices. If we go on to the next slide. Today, we have more health information at our fingertips to manage non-communicable diseases and thanks to the digital intervention. If you can see my watch from where I am, you'll see that I have a Fitbit on. For me today, a watch is not about knowing the time. In addition to knowing the time, I want to be able to know my heart rate. I want to be able to know the number of calories that I've burned today. I want to be able to know the level of activity that I've embarked upon today. How many steps have I taken? Am I moving frequently enough to ensure that the middle age bulge that forms around, I can keep it at bay to ensure that I live a healthier life. So this has become more and on an increasing basis, devices and gadgets that individuals are taking advantage of to ensure that we live a better lifestyle. Likewise, we all have a phone, but a phone has gone beyond hello, how are you? It's gone beyond making telephone calls to having apps that are on the phone that can enable me either get information. Today there are so many education library, digital library on health. I feel something that hurts, something is hurting me and paining me. I can quickly Google it or pick up some information about it that enables me know what to do and how to take care of it. Artificial intelligence, virtual healthcare, all of these are today available to the, I will say, regular individual, because today almost everybody has a phone, and we can just add to a phone maybe a digital watch or some other device that enables us to monitor the state of our health. Next slide, please. Today we have things like Apple Watch. Your Apple Watch is amazing what your Apple Watch can tell you. Your Apple Watch today can tell you your blood oxygen level. It enables you to know your blood oxygen level. It enables you to know the latest Apple Watch enables you to do ECG and know your heart rate, how well your heart is beating at a go by just a device that is tied to your wrist. And the opportunity that brings is that it has brought in tremendous power to the average individual to better manage their health. Yes, we're talking about diabetics in this year, but always remember that the totality of the functioning of your vitals is what determines how healthy you are. Because when diabetes strikes, it starts affecting. We just listen to the doctors talking about it affecting your kidney, affecting your kidney, affecting your heart, and affecting every other organs of the body. But being able to regulate and know how well those organs are performing enables you to live longer and manage your health better, and most importantly, take control of your life. And that is where digital comes in to enable you to take control of your life. We have Fitbit. We have different. I'm not recommending any device, but there are several devices that are out there today that can enable you track and monitor your activity level, and manage your risk level, manage your exercise. Remember, one of the big challenges that we have today is that with increasing demand on our time, we are less active. And living a life of inactivity is almost a recipe for NCDs to affect individuals. So we have these watches today that can even beep you every 1 hour and tell you, get moving, you need to move, you need to take 250 steps in every 1 hour. And that all of that enables you to ensure that you maintain proper activity level that enables you live a lot better. In the next slide, we'll see how a smartphone is being used to measure ECG, and different apps that exist today that are already commercially available in the market that enables you to do all of these nice things that can enable you manage your health better. Next slide. You know, the future is bright and beautiful. What do we see in the future? Today, we have apps that I can interrogate and put in the symptoms that I feel and can give me an idea of what illness or what is happening in my body, and even recommend medication to me, or at least tell me, go see a doctor. We have websites with a lot of information. We have a lot of research going into healthcare to empower the individual to be able to self-manage their health. And as we go into the future with artificial intelligence, big data, data analytics, and all the nice tools that are coming in handy, that is now becoming part of our lives, digital intervention will continue in healthcare. I believe that this will lead to people living longer, being able to better manage NCDs, and generally a brighter stage of healthcare. And maybe the next time we are talking about NCDs in a few years' time, we'll be talking more about how to ensure that people have more access to digital intervention tools than looking at how to distribute palliatives in hospitals to help people that are sick. But this is the direction that technology is going. It's going towards improving human life, prolonging death, and ensuring that the quality of life of the average individual is better. And lastly, I was listening to the TV yesterday, and I heard the vice president in Ghana telling us of how the hospitals are being increasingly digitalized, such that you don't need to have paper and files being moved from one table to another, and you can even go from one hospital to the other, and the doctor in the next hospital has a record of your life, of your vitals, of your medical history before you get there. As we deploy more technology, deploy more digital into healthcare, I think life will be a lot better. People will live longer, and we should see healthier population, healthier customers, healthier people to serve in banking, and healthier people that are living in the world. Thank you very much. God bless.
Thank you, Dr. Thomason. I want to confer on you the title of Digital Doctor. Digital Doctor. That was very powerful. We appreciate it. This is still the Ecobank Hour Regional Webinar. We now want to move quickly to some messages of commitment and solidarity from selected representatives. And we're going to start with Dr. Santiji Sise, who is a medical doctor, works with the Ministry of Health and Sanitation, and a fellow of the West African College of Physicians. He's the current director of NCD and Mental Health, co-chair of NCD and Injury Commission of Sierra Leone, and a commissioner of the National Disability Commission. If he's not there, we will move to Dr. Fred Amagashi from Liberia. Dr. Fred is a Liberian ophthalmologist and program manager who currently heads Grand Gede County Health System in Liberia. Dr. Amagashi, you have the floor.
Good afternoon. I'm Dr. Fred Amagashi. I'm actually the executive director for the Liberia Non-Communicable Disease Alliance. Yes, I formerly work with the Ministry of Health. So we're happy to be a part of this festivity for Ecobank Day 2020, and we're very happy that Ecobank chose to create public awareness on the non-communicable diseases, starting with cancer, now it's diabetes, and I understand there's mental health. The emphasis on NCD, of course, we all know is in the right direction, because we know that all the global agenda now is looking at NCD, as many of the speakers talked about, and this has been validated by the heavy toll that COVID-19 has on people living with diabetes and other NCDs. In Liberia, we live under the triple burden, as I would call it, a triple burden of poverty. Over 60% of poverty of the population lives in poverty, with a quarter living in extreme poverty. Then we have the communicable diseases. Malaria has been lingering for centuries. We have malaria, we have the HIV, the hepatitis, the neglected tropical diseases are rough. And now we have this exponential growth in the non-communicable diseases, where over the past 2 decades, we have had more than double the burden of non-communicable diseases, ranging from the cardiovascular diseases, the diabetes, the cancer, and so on. So we applaud the leadership of the Ecobank team to work with us as a civil society organization, where we strive to build this platform where we can have individuals, specifically people living with the NCDs, we can have these organizations and other stakeholders to work together with the Ministry of Health. As Dr. Boso pointed out, the Ministries of Health, especially like mine, is heavily underfunded, and as such capacity there too is kind of strained. So working together in this platform, we'll be able to call the attention of central government to commit resources. Because like in our situation where we have NCDs accounting for the 42% of the deaths and 38% of the overall disease burden, total expenditure on health is like 18% for NCD. Where and then because of that we have like 76% of the NCD care is taken care of from all of pocket spending. So we need to, as a civil society organization, with the support of Ecobank and the private sector in general, to work together with the Ministry of Health to develop these responsive strategies and develop the tools which we can use to even monitor what we are doing in non-communicable diseases. So working together like this, we will reduce the NCD burden, but above all, will contribute greatly to elevating the population from abject poverty. So thank you very much for having us.
Thank you, Dr. Amagashi. Let me go back to Sierra Leone, and we will take a quick presentation on behalf of the rep from Sierra Leone. We were hoping to hear from Dr. Santigi Sise, and we are told that Aina Moore will do the presentation on his behalf. So, Aina, if you can take it up. Thank you.
Yes, good evening again, and apologies from Dr. Sise, who had signed on earlier and is having network challenges. He's actually traveled outside of Freetown, so he's having challenges. I'm smiling because I know my boss Dan will tease me no end about network challenges. But Dr. Sise really wanted to be, he actually signed on earlier, but he's not able to do so right now. We are sorry. But I have gotten his statement and I'll read it quickly if I may. I first became aware of Ecobank Day when Ecobank Sierra Leone invited me to attend and make a statement at the free medical screening for non-communicable diseases in the latter part of 2019. I was very impressed that a financial institution would take such interest in health issues to the extent that it would dedicate 3 years to raise awareness to non-communicable diseases. Hence, the Directorate of Non-Communicable Diseases in the Ministry of Health and Sanitation felt convinced enough to partner to raise awareness, educate, and screen Ecobank staff and communities in Freetown. The silent killer has reared its ugly head, making it difficult for COVID-19 positive people to survive because of what medical practitioners refer to as underlying health conditions. This means that all efforts of the Ecobank Group to raise awareness through the series of webinars that have been going on, especially this one, during this time of COVID are admirable, commendable, and highly appreciated. The contribution of Ecobank Sierra Leone to our efforts in addressing the issues of diabetes in the country has not gone unnoticed. We also applaud and appreciate the support by Ecobank Sierra Leone to the Friends of Diabetes, an organization that gives support to people living with diabetes. As a directorate, our responsibility is to develop policies, strategies, and establish networks with local and international partners to improve the prevention, screening, diagnosis, and treatment of diabetes. I thank Ecobank Sierra Leone and the entire Ecobank Group and look forward to a greater collaboration for the health and well-being of our communities. Signed, Dr. Santigi Sise, Director of NCDs and Mental Health in Sierra Leone. I thank you.
Thank you, Aina Moore. I'm sure he will be very happy how eloquently you delivered his felicitations. So the final message of commitment and solidarity is coming from Guinea, and we are privileged to have Professor Nabi Balde, an endocrinologist who began his professional interest in diabetes in 1993. He is currently head of the Department of Endocrinology, Diabetes and Nutrition, and Gastroenterology at Donka Conakry University Hospital. He's a senior researcher and lecturer in endocrinology. Professor Balde is also Vice President of the International Diabetes Federation and has previously served as Chair of IDF Africa Region. Professor Balde, we have you on the floor. Thank you for joining us.
Transmissibles ont la particularité de peser très lourd en termes de morbidité et de mortalité. Ces faits sont particulièrement vrais dans les pays en voie de développement, dans lesquels l'accès aux soins est un problème majeur. L'apparition de la COVID a amplifié une situation déjà très difficile. En effet, les patients souffrant de maladies non transmissibles ont déjà à la base des problèmes d'accès au diagnostic, avec plus de 60% des cas non diagnostiqués, par exemple pour le diabète, avec une chute de la fréquentation des structures sanitaires de 60 à 70% en moins depuis l'apparition de l'épidémie. Il y a aussi des problèmes d'accès au diabète, l'hypertension, les maladies cardiovasculaires et respiratoires. Ces difficultés générales avec les maladies non transmissibles en Afrique font écho au constat suivant. L'engagement politique est de plus en plus manifeste. La prise de conscience des communautés est plus évidente, même si beaucoup reste encore à faire, mais la mobilisation des ressources reste le talon d'Achille. Nous sommes donc tous concernés par les conséquences dévastatrices des maladies non transmissibles. De ce fait, l'appel à l'action nous concerne tous, gouvernement, agences des Nations Unies, secteur privé, organisations de la société civile, patients, compagnies d'assurance. C'est à ce titre que nous saluons plus particulièrement l'engagement d'Ecobank qui nous réunit aujourd'hui. Nous saluons les initiatives d'Ecobank au niveau régional et local. Il s'agit d'un exemple d'engagement citoyen dans lequel, en Guinée, nous avons pu effectuer de la sensibilisation et de la mobilisation sociale avec la conception et la diffusion de capsules vidéo et audio, effectuer du dépistage sur 10 sites hors de la ville de Conakry, participer à des webinaires et offert un soutien financier à la Fondation Diabète Maladies non transmissibles en Guinée dans le cadre du renforcement des capacités des organisations de la société civile. Nous prévoyons d'animer ce week-end une émission santé sur le diabète à la télévision nationale guinéenne pour présenter toutes les initiatives qui ont été prises à l'occasion de cette journée mondiale du diabète et de Ecobank Day. Je salue donc particulièrement le sens de l'écoute et du partage qui ont caractérisé le partenariat sur 3 ans en faveur des maladies non transmissibles. C'est sur ces actions concrètes menées sur le terrain au cours de ce mois du diabète que je vous remercie pour votre attention. Thank you for your attention.
Merci beaucoup, Professor Balde. We were hoping you would speak English for us to translate because we're translating into French. So, but we thank you for speaking. We'll just summarize briefly what you said for our English audience. So essentially, Prof says the emergence of COVID has amplified an already difficult situation, and patients suffering from non-transmissible diseases already have at the base problems of access to diagnosis, with more than 6% of undiagnosed cases, for example, from diabetes. They also have problems accessing treatment, with more than 50% of cases diagnosed not having access to regular conventional treatment. There are treatment quality problems with few resources available. The quality of life of people living with NCD also impacted by the great anxiety load. And these general difficulties with non-transmissible diseases in Africa echo the following observations, including political engagement becoming more evident, community awareness becoming more evident, although much progress has to be made. And of course, resource mobilization is Africa's major Achilles heel. And it's a call to action because we are all concerned about the devastating consequences. And he essentially is calling on all government, United Nations agencies, private sector, civil society, and everybody else, including patients and insurance companies, to come on board. They also commended, or Guinea is commending Ecobank's commitment to bringing quality leadership in this matter by bringing all of us together with their rallying power. And they are also saying this is a good example of civic engagement. They have said they have performed awareness and social mobilization with video and audio clips. They have screened 10 sites outside Conakry, offered a check to the Diabetes MNT Foundation in Guinea, and they've also participated in webinars and hosted health programs on diabetes on Guinea's national television. And they particularly welcome the sense of listening and sharing that has characterized these three-tier partners in favor of non-transmissible diseases. And it's basically saying it's on these illustrative images of concrete actions taken that they have done. And they want to thank all of us for our attention. Professor Balde, thank you for keeping it short and sweet. We want to go back to our regional executive for closing remarks, but I want to say a big thank you to our panel members for the very insightful panel presentations. Dr. William Bosu, Dr. Adiza Ben Adinoyi, and Mrs. Elizabeth Denyo. We also thank our solidarity message people, including Dr. Amagashi, Professor Balde, and the rep who read Dr. Santi Gisise's message. So we're coming back to you, Regional Executive Mr. Dansaki. You started off with us. What are your closing thoughts? Thank you.
Thank you very much, Bernard. I was worried when Dr. Balde started speaking French. I was wondering what you were going to say, but so I am now comforted by the fact that you have accurately translated everything that he said. So my fears have been allayed. But distinguished panelists, invited guests, we've had quite an interesting session. This virtual event has brought together champions, leaders, advocates of NCD, especially people living with NCDs, focusing principally on diabetes. Okay. We've gained new insight into the vital role of civil society and community-led activities such as this. But I think more importantly, it has drawn attention to the fact that each of us in our own small way can help take action against diabetes. So wherever we find ourselves, we can start an advocacy group, we can educate ourselves to improve awareness about diabetes. And looking at the panel, I'm not sure we could have asked for, we could not have asked for a better panel, okay? Because the team of experts have provided us with great insights, how together we can work, we can start to work and chart a roadmap so that we change the tide of NCDs sweeping across both the regional and the local level. We are truly grateful for all the testimonies that they provided. And I was also surprised that my colleague Thomason brought on the digital aspect. I think this is something that we've all overlooked, that in our own small way, individually, we can contribute greatly towards the fight against NCDs. He touched on the digital intervention for people who are living with NCDs. In an era of digitization, the use of mobile phones, because today our mobile phones can have an idea, can give you an idea of your heartbeat, as he said, the number of calories you have burnt using your wearable health devices. You can also have access to very quick information on the internet, both on and offline digital platform. And this, for him, should really form a core part of our healthcare. Thomason, we are truly grateful because these tools should help our march towards universal health coverage and should be able to enhance the quality of our healthcare for people living with NCDs. Let me not also forget Mrs. Elizabeth Denyo, the regional chair for International Diabetes Federation, and Mrs. Alinda K. Solo. Thank you very much. Today, we've learned quite a lot about how we can move forward, and we believe that, one, in addition to what we do, we should take cognizance of the fact that our health system currently have challenges. They are focusing on the curative aspects instead of the preventive aspects. If you match that against Dr. Balde's assertion that healthcare facilities are inadequate, resources are inadequate, and then take into consideration the impact of COVID, that has made it even difficult to access the limited healthcare facilities available, then you realize that we have a fight. We have a mountain to climb if we are to be successful in our fight. And that is why the area of awareness creation, through training, through information dissemination, through sharing, using platforms such as this is important in trying to improve information about NCDs, especially diabetes. Thank you very much, Bernard. I am sure that the testimonies that we've heard, including the one who gave the example of living with diabetes and its impact, the near destructive impact on his life, that should sort of serve as a wake-up call to all of us, and we should do more to promote knowledge and awareness of diabetes and other NCDs in our system. Thank you very much. Mr. Moderator, it's your turn.
Thank you very much indeed, our able leader, Mr. Dansaki, and host. Amazing man. Before we take the vote of thanks from our regional head of corporate communications and marketing, Ghana and our, we've been joined by the chair for Africa NCD Network, who initially couldn't join us. So we're just going to take one quick comment from him. It's just one comment to let us know he solidarizes with us and basically agrees with some of the things we've said. So, Mr. Ferdinand Sonu, thank you for joining us belatedly. We are giving you 2 minutes to tell us everything you wanted to say in the first 20. So please go ahead. If you are there, Ferdinand, please make sure your mic is on before you start talking. Ferdinand, we really wanted to hear you today, but it looks like the stars have conspired for us not to hear you. I'm sure. Okay, are you there? If you are there, go ahead. No. Well, maybe today is not your day. Sorry. Let me take our vote of thanks from our regional head of corporate communications and marketing, Ghana, and our Mrs. Rita Chega. You have the final word. Rita, take it up.
Thank you very much, Bernard. Ladies and gentlemen, a very good evening to you all. The event has been a complete delight, and we want to thank God for a successful program. We also want to give a special thank you to our valued customers across the region, and also those customers who joined us globally across the world for this webinar. And for joining us, not only for joining us, but committing to this cause, to stand with us against NCDs. We want to thank our media friends from across the region. We have the media joining us from all the countries, and we want to say a very big thank you to them, because they will not only for joining us, but because of the pivotal role that we are expecting them to play in creating awareness. A special thank you to our partners, the International Diabetes Federation, the African NCD Network, the International Federation of Red Cross and Red Crescent Society, and the West African Health Organization, and the eminent people who have been represented. So a special thank you to our host, Mr. Daniel Saki, Mr. Thomason Fashina, and the very lovely Madame Aina Moore, who set the context for us. We also want to thank our expert panelists who made time to feature on this particular program. Mr. Ferdinand, for all your efforts to join us, Mrs. Elizabeth Daniel, the Regional Chair, International Diabetes Association, and Mr. Ben Adinoyi, Head Health and Care Unit, the African Region, International Federation of Red Cross and Red Crescent Societies. A big thank you to Dr. William Bosu, the professional responsible for NCDs at West Africa Health Organization, and of course, our moderator, the renowned Mr. Bernard Avli. We also want to acknowledge Ecobank Foundation, and we have among us the CEO of the foundation, Mr. Carl Mallan. And the foundation actually leads our efforts for such interventions. And Carl, we are very grateful for all your assistance, and especially for your presence this evening. May I also thank those who provided us with solidarity messages, Dr. Santinji, Dr. Fred Amagashi, and of course, Dr. Nabi Baldi. Thank you all very much. We are joined by Ecobank affiliates across the region. We are grateful to the affiliate businesses and heads for all that they have done in making this a success. We thank Ecobank Ghana Limited, eProcess International, Pan-African Savings and Loans, EDC, as well as Ecobank affiliates in Guinea, Gambia, Liberia, and Suriname. Ladies and gentlemen, thank you all once again and have a good evening. Together for better health, Ecobank, the Pan-African Bank. Thank you.
Thank you for thanking us. If you like the video, please share with your friends on social media and let others hear this great news. Till we come your way another time with another Our Regional webinar. My name is Bernard Avle. Thank you for being part of this conversation. We'll see you next time. Bye-bye.